Hello, this is Steve Allen, and I would like to share with you a L4 vertebrae. We're just going to review some bony anatomy and then couple it with its L3 vertebrae and look at some movement. But just to appreciate, as we have seen on some of the slides from Brett Windsor on the anatomy, we'll just look at the bone once again, noting the ring apophysis on the superior surface, noting in the body of the vertebrae a somewhat flattened, much more concave surface now that has formed in obviously what is an aged older lumbar vertebrae. And we remember from Brett's presentation the talk and about the spongiosa and the trabeculae, and how there is a loss of horizontal trabeculae as we age, and as the bones become less resilient and more towards osteoporosis, there is a general shortening of the stature of the vertebral body, accounting for our diminished height as we age. Here's the zone where the thinner zone of the vertebral end plate would be. The vertebral end plate surrounding the outer superior and inferior surface of the vertebral body, bordered by the ring apophysis and held to be somewhat thinner towards center, where that diffusion process of nutrients across the thin cartilaginous end plate into the nucleus takes place. As we look now towards the posterior elements, here's our pedicles resting on the vertebral body. These are the rod-like structures that are hollow in the inside so that they can absorb an incredible amount of torsion and compression from the attached muscles to these processes posteriorly. So the majority of muscles in the lumbar spine attach to the posterior elements. There are only two that attach to the vertebral body, and that would be the crura of the diaphragm anteriorly, as you recall, and the iliopsoas fibers that attach on portions of it onto the body of the vertebrae. So those two muscles alone. The remainder of the muscles, and we'll review those shortly, are going to be attached to the posterior elements. Greatest compressive loads then from dynamic contraction of muscles coming from muscles on these posterior elements, and the pedicles' job is to transmit that force safely into the vertebral body. So the pedicle then is going to be hollow on the inside, so that engineering principle of a beam is much stronger if it can bend and absorb tensile forces rather than being a solid mass or solid structure. The transition, as we reviewed earlier then, is going to be between pedicle and the lamina, the flat sheet lamina, and that transition zone is the pars. In the pars, we're going to have a fairly thick amount of cortical bone that is maintained for absorbing these forces that come off the lamina. Despite the increased cortical bone in the pars zone, it is still a vulnerable area for the spondylolisthesis due to a spondylolysis through this region or a fracture. And this is the oblique view that you can look at the x-ray to pick up that. Here's the leg of the dog, the Scotty dog's ear, nose, and there would be the neck on that oblique view. Notice the size of the spinous process, large projections with muscles well attached there that we'll be reviewing shortly. Looking at the orientation now of the traditionally described as more C-shaped, the surfaces of the superior articular process and the corresponding inferior articular processes of this vertebrae. The transverse processes have obviously been compromised, shortened up here on both sides. These would tend to be a little bit further out. You can appreciate just this view through the central canal, a large perforation to accommodate the vascular structures entering into and out of the vertebral body. The largest of these being the basivertebral vein. There can usually be up to 3 of these veins that will go into the vertebral body, and that perforation to accommodate those structures. Let's go ahead and couple L4 with L3, so we'll bring L3 in here and just look at some basic movements that take place segmentally. Now we have to do this without the disc interposed, so I'll try and do my best. So let's look at flexion as described by Lance Toomey, that there must be a corresponding glide along with the anterior rotation that accounts for flexion. It becomes obvious that there can be no glide in the stationary position. So these articular processes are hooked. The inferior articular process hooks onto the superior articular process and cannot transmit forward unless there is first a rotation movement. So the movement induced for forward bending will first be one of rotation. And when that rotation happens, there is an exposure. If you watch the inferior articular process, as it rotates, it exposes a portion of its articular surface. But that position now allows for the migration anteriorly. So you have rotation and then the slide forward, slide back and back to neutral. Here again. So we go into anterior rotation, which exposes a portion of the articular surfaces and allows the forward migration of the vertebrae off the one below. So forward flexion, traditionally then described as anterior sagittal rotation with an anterior glide. Appreciating that when we talk about those structures, ligaments and bones that can check anterior shear, our primary mechanism from a bony standpoint is the articular structures of the zeg joints that check forward shear. The hook of the processes together that stops or checks anterior shear. Let's look at extension. So extension will be in reverse. There will be a posterior rotation. So let's get it up so we have a little bit of disc space there. There will be a posterior rotation with a posterior glide, and ultimately an approximation of the spinous processes. Posterior rotation with posterior glide, and we see the zeg joints as they articulate with each other. In the literature, it is well recognized that in the superior articular process, there tends to be stress zones in the more medial aspect of the joint. And Toomey talks about the aberrant vertebrae that would move with more rotation and loss of glide. And that would result in, with that loss of glide, impaction of the inferior articular process into the superior articular process below. So if we look at this particular specimen, and try and get the light just right, there's a darkened area, again, just on the medial aspect of each surface of the superior articular process. Let me get the light on this one as well. So it's white, fairly translucent white surface here, and then it becomes more dark. I'm sorry for the light. There we go. Just kind of a darkened area that has a distinct color and roughening to it on these vertebrae, for example. And the other thing I think to do is just to appreciate, as we play with these bones, how strong these bones yet are, and particularly the ability of the lumbar spine to absorb compression. So if we put the posterior elements off the edge of a surface, and I can come up and place my hand over the top and my other hand over the top of that and put my substantial body weight smack down through the vertebral bodies, they withstand that force quite well. It's an incredible lightweight structure. Of course, now absent the trabeculi, spongiosa, and ability to absorb compression with blood inside, nonetheless, still remains an incredible piece of engineering and resilient to high compressive loads. Thank you.